Two Republican senators have introduced a bill to make it easier for veterans to get medical care at non-VA clinics and hospitals. It would build on the VA community care programs started under the Obama administration and strengthened under the first Trump administration. They say it would ease access to care for veterans, especially those in rural areas. Now, there are a few critics that worry that steering veterans to private facilities might actually steer some of the federal funding away from VA healthcare services. It's being called the Critical Access for Veterans Care Act. It would expand access by veterans to critical access hospitals and affiliated clinics under the Veterans Community Care Programs. Veterans who live within 35 miles of a rural critical access hospital would be allowed to use their VA benefits to cover care there or at their affiliated clinics without needing a referral from VA staff. One of the bill's co-sponsors is Senator Kramer out of North Dakota, and he said his state, for example, has only one VA hospital, and that's in Fargo, which could be a 400-mile drive for some veterans. This bill would expand on previous laws like the VA Mission Act, which has already made it easier for veterans to use their benefits to cover care at community hospitals and clinics, but reduces the paperwork and the need for more approvals for those veterans. There are some concerns, like we said. Other legislators agreed there is a need for outside care for some veterans, but the concern is in shifting the VA department's money to support private healthcare facilities by siphoning away from veterans' hospitals and clinics. And some veterans advocacy groups have also expressed concern, and they say while they also want to see it easier for veterans to find care, they don't want to see VA facilities weakened in the process. You can read more on that bill. We link to it in the description below.